So being connected to the PRC definitely put me on a path in academia that I always wanted to be on. So going into my doctoral program, I always knew that I wanted to be a professor, that I wanted to hold a tenure track faculty position at a university. And I had that goal when I came into the PAM fellowship program at the PRC and talked about that with my mentors. And they did an excellent job preparing me for being a great candidate once I went on the faculty job market. So my mentors and just the structure of the PAM program and my connections to the faculty and staff at the PRC made sure that I was able to attend any skills workshops that I needed, to be able to audit classes, to be able to attend and speak at conferences, publish papers, work on grants, and get all those necessary skills that were going to make me a really great candidate once I went on the faculty job market.
PAMT gave me the opportunity to work with and learn from some really talented people. I was able to build my network of colleagues and establish long-lasting connections with my PAMT mentors as well as with other trainees. I found PAMT to be a very supportive environment in which to learn new research skills, and I think that was a reflection of the faculty who are very generous with their time and dedicated to mentorship, as well as the other trainees who are very supportive of each other's careers.
Being connected to the Prevention Center has shaped almost every facet of my career, from being a student to then being in government, being an affiliate from afar, coming back and being a faculty affiliate at Penn State, and then ultimately now being the director of the Prevention Research Center has really played a tremendous role in my career path. I really learned at the foot of masters working with Mark Greenberg and Scott Guest, Mark Feinberg, Rob Teresi, Janet Welsh. The entire kind of cast and crew and characters of the Prevention Research Center really taught me so much about what I know and understand to be prevention science.
So being connected to the PRC really helped me when I returned to the Czech Republic, and it was so easy to find a job and choose a good job for me. I was working for the Charles University, for the Czech National Institute of Mental Health. I was working on really great and wonderful projects. Just having the experience of being part of the PRC and being a PAMT fellow, I really was absorbing so much information, so much experience. It was just incredible to be part of so many conferences and meeting just wonderful people who were sharing, who were generous, and I really loved the sense of scientific community that PRC and the PAMT created, and being just immersed in this bright and wonderfully thinking environment that's creative and innovative. It was just, I really felt it was a treat for me to be part of that.
PAMT has significantly shaped my career trajectory. It has given me the time and support to work on my job applications. It has given me the platform and opportunity to network with colleagues and mentors from different places.
Being connected to PAMT has greatly shaped my career trajectory. PAMT provided me with the time necessary to learn new methodologies, such as structural equation and multi-level modeling, to dive deeper into the literature of substance use prevention, and to apply for an F31 predoctoral fellowship through the National Institute of Alcohol Abuse and Alcoholism. PAMT also gave me the opportunity to connect with faculty, postdocs, and students from other disciplines, which has expanded my professional network.
I have to say that the thing that I'm most proud about related to my time at Penn State's Prevention Research Center is when I was appointed as the director of the CSU Prevention Research Center. I think that I was convinced when I left the PRC at Penn State that I was never going to work at another place that was as scientifically rigorous as supportive and as community engaged as the Penn State Prevention Research Center. So in 2019, when I was asked to direct the CSU Prevention Research Center, I jumped at that opportunity, and I'm trying my best to at least approximate all of the great work that's going on at the Penn State Prevention Research Center. I still connect with Janet Welsh and others at the PRC, and now we're the CSU PRC is going great guns. We're doing a lot of great work, and I'm in a context where I'm able to lead a group of scientists and practitioners that truly love the work that they're doing and love working at the CSU Prevention Research Center.
When I think of my proudest accomplishment, I think I also have to tell you about a moment when I was pretty naive, or maybe even a little bit arrogant. It's amazing how as a graduate student you can know so little and yet at times be so arrogant. So I had the opportunity to work with Linda Caldwell and Ed Smith on a project they had at the time, which was an implementation quality trial in the Cape Town area of South Africa across something like 56 high schools. But in that project, I was able to kind of carve out a little research question for myself and really felt, from my shared office space in the Ford building, that I had a good feel of the issues at hand, the factors involved, what I would see, etc. And then I had the opportunity to go to South Africa, to go to the schools we were working in, to talk with the principals about their experience, and it was quite humbling. And it reminded me that I always need to be ready to listen. Even when I think I know what's happening, I still need to be ready to listen and hear others' experiences. I predominantly do community engaged research. So this is a lesson that's really stayed with me and is really integral to how I approach my work today.
One of the things that really stands out to me from my time at Epicenter was this paper I worked on with Brian Bumberger and Brittany Rhodes Cooper. So at the time, there was a lot of tension in the literature about adaptations. And people were kind of doing this philosophical debating back and forth about adaptations. But we had real world adaptation data that was on the ground. We had real data that we could use. And so we pulled this data together and looked at the real world adaptations that were happening and ultimately turned it into a publication. And there was something that felt so unique and special about being able to take this philosophical academic debate and then use real implementation practice data and kind of fuse the two of them together. And I feel like that was part of what made the model so unique, was this ability to bridge the research and the practice and bring those pieces together. That still to this day, I think is kind of a unique place in the system as the field struggles with understanding how we merge research and practice to create the maximum impact that we can. And so when I think back, that is definitely one of the things that kind of stands out to me the most, and I still remember many years later.
My biggest accomplishment at the PRC was receiving the fellowship. I was able to focus for all my years of education, almost exclusively on research. So all of my time went to a research assistantship, and I was able to focus on developing my program evaluation skills.
It is hard to pick just one favorite memory of PAMT because the friends and colleagues that I made during my time as a postdoc, I still talk to today. One that comes to mind in particular was our trip to DC to visit NIH, where we got feedback from project officers on the grant proposals that we were working on in our boot camp.
And my favorite memory from PAMT was just the weekly meetings we had, just to have an opportunity to learn from a group of really kind and friendly, but also really smart peers and mentors was just the best experience and gives me the warm fuzzies just thinking about it.
Some of my memories about PAMT are really about the community and the people. I remember, of course, not only being in the classroom and learning all kinds of things, but what happened outside of the classroom, right? Getting together at SPR, hanging out around State College with some of the people that I went through PAMPs with, right? And these are people like, I'm sure I'm going to forget some, but Stephanie Lanzon, Bethany Bray, Michael Cleveland, Brittany Rhodes Cooper, Donna Kaufman, right? I think those relationships were really important to me as a graduate student. Of course, they were so skilled and smart. I learned a lot from talking to them about my work, but I also had a community of support, and that was really important to me at that time. And I think that combination was really powerful. And as I've left Penn State, I realized that that was really unique. That was something that PAMP intentionally created that was really valuable. And it's something I've tried to create in my own field, in my own worlds as I've gone forward in my career.
And my favorite memory of my PAMP training is the interactions I had with my methodology colleagues and prevention and communication scholars like myself, to be able to witness really the synergy between those two fields, how that gives insight into tackling complex public health problems.